Now coming to the next topic, that is allergic reactions. This is a very vast topic, okay? It has a lot of subtopics, but again, very important. All right? Take each disease peacefully. Don't think that everything can be remembered in one day. I'm talking about all the subjects in general. And again, I'll tell you one thing, just with some name, there should be some image in your head. Only then you will be able to get right answers. Okay? Because medicine is so vast, you have 19 subjects to mug up. You will be very confused in the exam. And any easy question that you do wrong because of confusion is going to bring down your rank drastically. Alright, so just remember this trick. It has always worked for me. Some name, some image. That's it. Okay? Now for allergic reactions, the first reaction is eczema. Very important, very frequently asked. I feel dermatology is not a very vast subject. It's a very easy subject to remember. And जो भी topics है ना वो सब बहुत important है. उन सब से ही questions आते हैं. So just make sure that about everything you know something. Okay? So eczema, now see, eczema is a reaction pattern of the skin. Okay? Secondary to whatever stimulus is there. So क्या हुआ मतलब इसका that there was some stimulus. It can be a stimulus from outside. It can be a stimulus from inside. To that stimulus, your skin has reacted. That's it. That is eczema. Okay? Some stimulus, your skin showed a reaction. Now, the stimulus can be from outside is called as exogenous stimulus, and from inside is going to be endogenous. Okay? So, endo is andar se. Endogenous and exogenous. Depending on this, you have certain disorders. Now, classification of eczema. See, your skin is showing some reaction. For how long? If it is acute, the reaction has been shown for very little amount of time, 4 to 6 weeks. If it is subacute, it is from 6 weeks to say 6 months. And chronic, your skin has been reacting to something for the last 6 months. So now it has become a chronic eczema. Okay? So you have acute eczema, subacute eczema, and chronic eczema. Important because these are questions separately. Acute eczema is a separate question, chronic eczema is a separate question. Okay? Now, when you look at acute eczema, matlab tumhari skin is reacting to something for a very small amount of time. So, how is it going to look? You have an eczema, you came to me. I saw you in the OPD. I have to classify because my treatment is going to differ from acute, subacute to chronic. The treatment is different. So, I need to look at it and understand कि ये acute है, ये subacute है या ये chronic है. Okay? तीनों अलग दिखते हैं. Good for us. All three of them look different. For acute, you will have erythema. That is redness. There's going to be edema, that is swelling. There's going to be oozing, and there's going to be some amount of crusting. Not a lot, some crusting. Okay? So basically, it has all signs of acute inflammation. There is rubor, there is scalor, there is daller, everything is there. Okay? So that is acute eczema. When you look at subacute eczema, तो जो redness था, redness is a very short-lived thing. ठीक है? 1 महीना रख लोगे तुम redness को, but you can't keep redness for say 6 months or 4 months. So that redness, it starts to disappear. That edema will also settle down. That oozing will also dry down now. Okay? So this person, after say 2 to 3 months of the skin reacting to something, redness चला गया, edema भी चला गया, तुम्हारा जो भी oozing हो रहा था वो dry हो गया. So this person will mainly have crusting because वो oozing dry हो गया, and some sort of scaling is going to be there. See, I'll tell you, you must have seen this in your body yourself also, कि अगर कहीं पे swelling आती है, ठीक है, and वो swelling फिर subside हो जाती है, that place becomes very itchy, and that place has a lot of dryness. It can be any swelling. It can be swelling after a fracture. It can be swelling because of an insect bite, anything. Whenever the swelling subsides, there's going to be itching and there's going to be dryness. So वही हुआ, acute में swelling था, subacute में swelling subsided, and scaling, you know, a lot of dryness, that scales started coming, and crusting happened. Now, in chronic, मतलब तुम्हारा skin react कर रहा है for a very long amount of time. It's been months to sometimes years. What happens is that you have been itching for a very long amount of time. Okay? Now you kept itching. Itching is sort of a trauma to the skin. So skin will adapt to it. Skin will think, yaar, this one's not stopping the itching only. I have to do something to protect myself. So to protect itself, skin will become thick in that part. Okay? हम barrier बढ़ा देंगे because barrier को तो ये निकालता ही जा रहा है because of itching. So we will increase the barrier. That is thickening. Okay? That is lichenification. So lichenification, there is hyperpigmentation, there is thick skin, and there is increased skin markings. Look at this. This is not an Indian leg, so थोड़ा hyperpigmentation कम दिख रहा है, हमारे में hyperpigmentation ज़्यादा दिखता है, ठीक है? But you see this part, there is redness over here, but this basically is hyperpigmented in us. ठीक है? There is hyperpigmentation. There is thick skin. The skin has become thick. It has become 3D. Wait, just look at this. You can see that the skin is elevated over here than here. Okay, so there is thick skin. Now look at these things over here. Look at this, 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 this. What is happening? These are skin markings. But in your and my foot, I'm not sure about yours, but in my foot, I don't see these markings. Okay? Why? Because there is no lichenification. So अभी स्किन इतनी थिक हो गई कि स्किन के फोल्ड्स तुमको बहुत क्लियरली दिखने लगे. Okay, skin became so thick that the folds are clearly visible. This is going to be your visible skin folds. Okay. So these three things are going to be a marker for lichenification. Now the problem is that exam mein na, they're not asking very simple questions. This was a question I think this year in NEET or in FMGE, but what they had asked was that which all diseases will show lichenification. So lichenification, why is it happening? It's happening because of itching. Okay, itching is the main thing. But understand, if you are itching for 1 month, the skin will not show lichenification. Okay, so suppose scabies is present and scabies या फिर टीनिया आ गया या फिर you have insect bite. ठीक है, that insect bite, you are not itching that insect bite for a year. If you are itching, lichenification हो जाएगा, but normal people, they don't itch that insect bite for a year. Okay, so lichenification is not seen over here even though there is itching. If there is scabies and you have taken a treatment for scabies, lichenification is not going to be here because you are not itching for a very, very long amount of time. If there is tinea, which is a fungal infection that again you have taken treatment for, there's going to be no lichenification. Okay, so just remember that diseases that are short-lived will not show lichenification. I hope you're understanding this. This is a very important question. Okay, now see. We classified eczema as acute, subacute, chronic. Acute के symptoms थे, रूबर कैलर डैलर था. Subacute में वो सब subside हो गया था, जो oozing था उसके crust बन गए थे और scales आ गए थे. And in chronic lichenification, अब the problem is chronic itching. In chronic eczema, the problem is chronic itching. So you have lichenification. Lichenification has three main things. There is hyperpigmentation, there is thick skin, and there are increased visible skin folds or markings. Okay, so this is chronic eczema. What is this? What do you think this is? Look at it. क्या दिख रहा है? ज़्यादा crust दिख रहे हैं ना? You can see all of this crusting. You don't see that much of edema, but you see a lot of crusting. This is subacute eczema. Okay, what is eczema? Your skin reacting to some stimulus. Now, what can be the stimulus? I've told you stimulus can come from outside, that is exogenous stimulus, and it can come from inside, that is endogenous stimulus. When it is exogenous stimulus, the eczema you get are different. When it is exogenous, you can get contact dermatitis, you can get phytophotodermatitis, you can get photodermatitis and atopic dermatitis. When it is endogenous, you can get P. alba, seborrheic dermatitis, atopic dermatitis and steatotic dermatitis. You see, atopic dermatitis can be both exogenous and endogenous. It is actually a mixture of exogenous and endogenous. Don't worry. I know the names look weird, but you're going to read about them in detail in like 5 minutes. Okay, and each one of the diseases is going to be touched. Don't worry. Alright, let's go ahead. The first one, what I'm going to read is contact dermatitis. Contact dermatitis is an exogenous, exo बाहर से आया हुआ, eczema is contact dermatitis. ठीक है? Contact dermatitis can be of two types, either irritant or allergic. Irritant मतलब सी contact हुआ और dermatitis हो गया. Contact हुआ and my skin reacted. That is contact dermatitis. Okay? Because of contact, skin reacted. Now, was it an irritant or was it an allergen? उस पर डिपेंड करेगा इरिटेंट कॉन्टैक्ट डर्मेटाइटिस या एलर्जिक कॉन्टैक्ट डर्मेटाइटिस. बेसिक्स. इरिटेशन, अगर कोई चीज इरिटेट कर रही है, इट कैन इरिटेट यू ऑल्सो, इट कैन इरिटेट मी ऑल्सो. So irritant contact dermatitis can happen to anyone. Okay. Allergic. Suppose you are allergic to something, but I am not allergic to that thing. So allergic contact dermatitis does not affect anyone and everyone equally. Okay. If you are predisposed to that thing causing allergy, you will get allergic contact dermatitis. If I am not predisposed, I will not get it. Understood? That is the basic difference. Irritant सब में हो जाएगा, allergic सिर्फ उनमें होगा, the ones who are predisposed. Okay, let's read. Irritant contact dermatitis, it affects anyone who's exposed. Okay, anyone who's exposed. Allergic contact dermatitis affects only the genetically predisposed. Makes sense. Irritant में क्या हुआ? Irritation हुआ. That thing directly came and damaged my tissue, caused irritation. So this is due to direct tissue damage due to irritation. Allergy is basically a type of hypersensitivity reaction. So this is a type 4 delay type of hypersensitivity reaction. Okay, अभी irritation हुआ है, मेरा tissue damage हुआ है, what will happen? I will have that burning, that uneasiness and burning sensation. Okay, so irritant में भी खुजली होगी, I will also have itching, but I will also have a lot of burning. So more burning is here, and allergy is just you going crazy. So there's going to be itching. There's more itching in allergic contact dermatitis. ठीक है? Again, irritant contact dermatitis. अगर suppose I was washing the dishes and detergent से मेरे को irritation हुआ, तो irritant contact dermatitis is localized to my hands only. If I have allergy to say somebody's perfume, or if I have allergy to weed grass, ठीक है? I have some allergy to a flower. So allergic contact dermatitis is not localized to say my nose only. My whole body will have that allergic response. But irritation is only limited to the place that was exposed to the irritant. Okay? So this is restricted, sharply demarcated to the site of exposure. Example, detergent dermatitis. But allergic contact dermatitis, starting में थोड़ा सा होगा, but it tends to spread and it becomes more generalized. ठीक है? So this is the difference between irritant and allergic contact dermatitis. This is the easiest way I could have explained it. I hope you get it. The next thing is that there are certain things you need to remember. These are one-liners, but very important one-liners. Most common allergen. हमने देखा irritant contact dermatitis and allergic contact dermatitis. Now in that allergic contact dermatitis, what is the most common thing that is causing allergy? It is metals. And metals may be nickel. So what happens is that you might have seen in your family, it's very frequent, even my mother has it, that whenever you wear something that is not gold, okay, whenever that has some amalgamation of metals and it has nickel in it, they start developing a lot of itching over here. That is allergic contact dermatitis. Okay, in cement workers, there can be a contact dermatitis because of potassium dichromate. People who are working with cement all the time, we have these patients very frequently come to us in the OPD. They have legs involved up till the knee and they have hands involved up till the elbow, because they are constantly putting in the cement, okay, and mixing the cement and working with that. So the problem here, what is that allergen? That is potassium dichromate. Okay, there's something called as diaper dermatitis, happens in very small babies who are using diapers. So उसमें क्या होता है? That convex areas are involved and flexures are spared. What is a convex area? We have bio. थोड़ा सा मुश्किल हो सकता है. This is concave. It's like a cave going inside. This is convex. This is convex. Okay. So imagine a baby's bum. So bums are convex. They are round. So those areas are involved. But the flexures in between the thigh, okay, that area is spared. Why? Because the diaper is touching the bum, na? It is not touching the thigh easily. So flexures are spared and the convex areas are involved. Okay. Now there's something called as hair dye. It can cause irritation. It can cause allergy in a lot of patients. Okay. Does not happen in everyone, but can happen in some patients. Why? Because of PPD. Paraphenyl This is the problem in the hair dye which can cause, contact dermatitis to patients. Now, sometimes neomycin can also cause a lot of problem. We have patients who have skin cuts here and there and they just apply any antibiotic in the house and then it just flares up and they come to the OPD and they're like, I had a small cut here, now I don't know what has happened. When you ask them, they will give you a history of applying a random antibiotic. when you ask for the antibiotic's name, you will find that it has neomycin in it, because neomycin can cause that contact dermatitis, allergic contact dermatitis. Okay. Sometimes what happens, patient applies a bindi over here, and because of that constant bindi, they develop irritation to the glue. The irritation is due to paratertiary butyl phenol. Okay, the glue keeps irritating them, but it is a family tradition. They are married and they cannot remove the bindi. Ultimately, they have either a very big red, plaque here, or sometimes they completely have loss of pigmentation here. Okay, that is bindi dermatitis. I'll show you the images of this. See, this is the hair, and this over here you see irritation. This is like dermatitis. So what is this? This is hair dye. What is the enzyme in hair dye? PPD. PPD is in hair dye. You have to avoid if somebody has this. Okay. So this is hair dye dermatitis. Now this is a small baby. You see that the diaper is going to touch this part. The diaper is also going to touch the bumps. But this is the characteristic flexures being spared. Okay. You see this part? The flexures are spared. Why? Because the diaper will not be able to touch it. Okay. So this is diaper dermatitis. Now you look at this poor woman. She has a big problematic red scaly plaque here. Okay. Why? Because of this bindi, but she cannot stop applying the bindi because the husband is protected by this bindi, according to them. Okay. So this is what? This is bindi dermatitis. Okay. Why are you getting bindi dermatitis? That is because of paratertiary butyl phenol. PP, BP. Okay, this is bindi dermatitis. Okay. So these are some examples of dermatitis that can happen. What is dermatitis? Dermatitis is eczema only. Alright. It's just your skin is reacting to something. It can be endogenous, it can be exogenous. Some stimulus, your skin is reacting to it. Now we start with Parthenium dermatitis. Parthenium dermatitis is sort of a contact dermatitis. All of these are contact dermatitis. And diaper se contact hua tha, hair dye se contact hua tha, bindi had contacted you. Alright, all of them are basically cement contacted. Nickel metals, they came in contact. Okay, all of these are contact dermatitis. Parthenium dermatitis is also a contact dermatitis. What is Parthenium? See, NCERT में पढ़ा होगा बचपन में 12th class में, that there was something called as Congress grass, okay, which was Parthenium or Congress grass. This is a very common sort of an allergen, okay. This Parthenium dermatitis does not happen to everyone. This is not an irritant contact dermatitis. It is an allergen contact dermatitis. It is ACD. Some people have allergy to Parthenium. Only those people will develop this dermatitis. So what is the allergen in these patients? See, the allergen found in Parthenium, that is Congress grass, is going to be sesquiterpene lactone. So SQL. Sesquiterpene lactone is the allergen that is found in Parthenium grass, the Congress grass. Okay. Why is this an airborne contact dermatitis? See, kya hota hai sometimes, not sometimes, a lot of times, we have patients that come to us and around the house, this just grows. Nobody plants Parthenium. It is wild, it just grows by itself. Okay. So around their house, they have this Congress grass growing. Alright. This Congress grass ka jo small seeds, they just completely fly in the air. Okay. And they have this allergen. The SQL allergen is present. Now this SQL allergen is in the air. Okay. The entire family will not get the problem. Why? Because this is not an irritant contact dermatitis. It is an allergic contact dermatitis. Some old Babaji in that house will be allergic to this SQL. Okay. And that poor man will develop contact dermatitis all throughout the body. So that is why it is an airborne contact dermatitis. The plant chemicals, when exposed to sunlight, they cause dermatitis. Okay. Because sunlight is also a factor over here. It is phyto, which is plant, photo, which is sun dermatitis. Okay. Plant, sun, dermatitis. Alright, this is Parthenium dermatitis for you. एक बार छोटा सा summary बोल देती हूँ. Again, I'm going to say it. It is a contact dermatitis. It is an allergic dermatitis. It is an airborne dermatitis. Because of the Congress grass, it has an allergen that comes out in the air, and sunlight is also involved. That is why it is a phyto plant photo sun, phytophoto dermatitis. Okay? Look at the image over here. You cannot diagnose the person by image. Even as a postgraduate or as a dermatology doctor specialist, I cannot diagnose this person just by the image of the hands. I have to ask them the history. They will give me the history of, because all contact dermatitis more or less look the same. It's my headache to understand ki ye contact dermatitis is because of what. Okay, but if you see, there's going to be this is a chronic problem. That is why they have this flat topped small papules. The person has been itching for a very long time. Everything is hyperpigmented. This is going to be everywhere on the body. Okay, don't worry about the image. The image is just there for you to understand, but just remember why the problem is happening, because of the Congress grass. Okay? Clinical features mean this person, imagine this as a very old man, old dadaji, old babaji, whatever. He comes with intensive itching because it's an allergic reaction. In irritation, there was more burning. In allergic, there was more itching. So they have a lot of itching. And because it is a chronic problem, lichenification may be present. If the patient came early to you, it may be absent. Okay? Site involved are usually sun exposed. Why? Because it is photo. Sun is involved. So that is why sun exposed areas are involved. That can be the face, the neck, the upper eyelids are going to be involved. V of the chest is going to be involved, So this is where the person is going to have the symptoms. Diagnosis is going to be a photo patch test. What is patch test? Basically, it is a test that is done for anybody who's having an allergic contact dermatitis. So I'm going to talk about it in detail, don't worry. Just a quick summary about it. That we put a lot of allergens on the back of the person, and just maybe positive aya, that is a positive allergen. Okay, so we do a patch test. Photo patch test matlab usually not all patch tests are done in the presence of sun, but यहाँ पे हम sun को भी factor लेंगे और allergen को भी लगाएंगे, and then we'll do a patch test. Okay, treatment, if it is an acute problem, you just give them systemic steroids, hit hard, hit strong, high dose of steroids, and just do khatam. Okay, like that. You don't continue steroids for a month. You give it for 5 days. That's it. If it is a chronic problem, you cannot give chronic steroids for like months and years. You can't do that. So for that, you can give them azathioprine. Okay. Another thing, because it is an allergy, you have to prevent anything that is causing you the allergy. ये जो हम कर रहे हैं, all of this that we are doing is to protect or to just curb the current allergic episode. Okay, this cannot prevent next allergic episode. Uske liye you have to completely prevent contact with whatever is your allergen. In this case, the Parthenium plant. So you have to completely avoid the plant. Okay, घर के आसपास है निकलवाओ, throw them out. You don't need them. All right. So this is Parthenium dermatitis. It is an important topic. Few points you can have to remember. I hope I've made it easier for you to understand. Okay, Parthenium dermatitis was one. The next thing is Pedras dermatitis. What is it? It is an insect bite reaction. See, insect can bite you, insect can bite me. Not all of us will develop this condition. Okay, some of us, sometimes we can also, sometimes we can't. What happens is, जो insect तुमको bite कर रहा है, उसका saliva will be an irritant, not an allergic thing. Insect bite, all of us will react to it, but the degree to which we react to it depends person to person. Okay, but the saliva is going to have some sort of irritant in it, and when they bite, that irritant is going to come out and it's going to give this picture, which is a classic irritant picture. Okay, abhi yahan pe what is important, how do you just look at the image and tell that this is a insect bite? This is a child, usko idhar insect was biting, theek hai? Maybe while he was sleeping, the insect was biting. So there was a sudden sting here. He flexed the arm. Now he squashed the insect between the two arms. Okay, between like the upper and the lower limb ke beech mein, he just squashed the insect. So similarly, you have one lesion over here, and if he flexes it, the other lesion was going to overlap this when he was flexing it. So both the areas are going to be involved. Okay, what are these? These are kissing lesions. Why kissing lesions? When they come closer, they touch each other, they kiss. Okay, so this is a kissing lesion of Parthenium of Pedras dermatitis. Okay, parthenium ho gaya hai. This is petrous dermatitis. So the kissing lesion of petrous. Okay, you understand? If you look at these kissing lesions, just know that this is petrous dermatitis, which is an insect bite reaction. All right. The next thing is a khatmal dermatitis. Khatmal is what? It is a bed bug. We have again a lot of kids that live in the hostel. They come to us in the dermat OPD with very vague red marks on the body. It can be papules, sometimes it can be just a macule, okay? And they're erythematous, they're red in color. Just like how you had kissing lesions in petrous dermatitis, in bed bugs, in khatmal dermatitis, you have a breakfast, lunch and dinner sign, okay? Matlab that khatmal came, drank a little bit of blood here, that was his breakfast. In the same line, he came for the lunch. In the same line, he came for the dinner. Again, he came for breakfast over here. For lunch, he came just right below. And for dinner, he came even lower. Okay. So, there are 3 lesions in the straight line. Okay, one is breakfast, one is lunch, one is dinner. Ye dikhta hai. It's not just theoretical. This is what we see in the patient. Okay. So, this is khatmal dermatitis, that is bed bugs. They have a breakfast, lunch and dinner sign. Okay. Then I have told you already about patch test. So see, patch test kya hai? It is basically being done in patients who have allergic contact dermatitis. Okay, to identify the causative agent. You have allergic contact dermatitis. Just know that when I see a patient of contact dermatitis, just by looking at the patient, I can differentiate irritant and allergic, because irritant has an irritant picture and allergic is very, very vague. Okay. So I look at it, I understand ki irritant hai ya allergic hai. I came to the diagnosis that okay, this is allergic. But now either I have to take a history from the patient wherein the patient clearly says ki haan maine, I did this and this is the allergic component, which is why I have this problem. 90% of the times the patient are not able to understand ki why are they getting this allergic contact dermatitis. Okay? So to know possible allergens, we do a patch test. Okay, so we give them all the possible allergens that are there. We put these round things. Each one of them is a possible allergen and we put it on their back. Okay? When you remove it, whatever is an allergen, whatever that person is sensitized to, whatever is an allergen to this person, that area will become red in color. Everything else will be fine. This will become red in color, maybe this will become red in color. So 3-4 things you will come to know that okay, this person is allergic to these things. Then you tell the patient to avoid those things. Okay, so that is the diagnosis of patch. That is the basic advantage of patch test. Okay, so to identify the causative agent in patients with allergic contact dermatitis. Again, allergic contact dermatitis, it is a type 4 hypersensitivity reaction. Ek baar you've pasted this to the patient, on the patient you've pasted this. When do you take it out? So it can be read at 2 days. So 48 hours ke liye you leave it on the back and then you take it out and then you read. You see the readings. Best reading is done at 4 days. Okay, sometimes you can even leave it for 4 days. Sometimes you can take it out after 2nd day and still call the patient again on the 4th day to see a good, allergic response. Okay, so this is your patch test. It's an important question, can be asked. Now, we saw a lot of exogenous eczema. Petrous dermatitis, insect ka was the problem. Okay, Parthenium dermatitis, Parthenium outside was the problem. Khatmal ka bite was the problem. Again, exogenous. Okay, allergic irritant contact dermatitis, exogenous. Endogenous matlab your body is itself going crazy. Okay, the first thing is seborrheic dermatitis. Endogenous matlab from inside you are developing the problem. Seborrheic dermatitis. What happens over here is that there's a Malassezia yeast. Malassezia is a fungus that is found on your body, on my body. But I don't know about you, I don't have seborrheic dermatitis. Okay? So, not everyone's supposed to get seborrheic dermatitis just because of Malassezia. But some patient ka body will go crazy. It will overreact. So, the problem is endogenous now. Okay? To that Malassezia and it will show eczema. Alright? Let's read. Inflammation of the seborrheic areas due to Malassezia yeast. Okay. What happens in seborrheic dermatitis? See, seborrheic areas, when you say, this is how I had learned it. Stand under shower. whatever touches you is a seborrheic area, wherever the water touches you, okay? So it touches on the scalp is a seborrheic area. It will touch on the forehead, the eyebrows, seborrheic area. Eyes ko utna touch nahi karega. The very first drops, they will just go down like this. It will touch the angle of the nose, seborrheic area, okay? It will, on the back, it will go in between the scapular area first, seborrheic area. V of the neck, seborrheic area. So all of these areas behind the ear, just how the water flows are seborrheic areas. Okay? So in these areas, you develop yellow greasy scales. Sites are scalp, face, nasolabial fold, retroauricular region. Okay? If you look at the image, you see this person developing all of this irritation around the nose. Basically the nasolabial area. They may even have the irritation around the forehead. It may also be around the eyebrows. Okay? So this is your seborrheic dermatitis. They're going to be yellow, greasy scales. That is very important, greasy, okay? They're yellow in color. The disease becomes very, very severe in patients who have Parkinson's and the people who have HIV, okay? It's just that it is severe over there. Now, the close DD of seborrheic dermatitis is psoriasis. Why? Because psoriasis also has scales. Seborrheic dermatitis can involve the scalp. Even psoriasis can involve the scalp. ठीक है? How will you differentiate? Psoriasis, अगर ये psoriasis का scalp है और ये seborrheic dermatitis का scalp है, this will have yellow, greasy scales. Psoriasis will have silvery white scales. Okay? So just because somebody is coming here, I have scales on the scalp, you cannot come to a diagnosis with that. You will have to first closely examine the scales and only then you can tell them, okay, is this psoriasis or is this seborrheic dermatitis? Sometimes it is also sebopsoriasis. Sebopsoriasis is what? Has some features of seborrhea, that is seborrheic dermatitis, has some features of psoriasis. ठीक है? Sebopsoriasis भी हो सकता है. So a very close DD of seborrheic dermatitis is psoriasis, which has silvery white scales. Infants also sometimes can develop seborrheic dermatitis. And that is called as a cradle cap. You see how yellow these scales are. Let me just make it easily visible. See all these yellow greasy scales on the scalp. This is called as cradle cap. Why cradle? Because they're kept in the cradle. The cradle is a thing that goes, like cradle. And in that, the child develops this thick lesions over here. Looks like that there's a cap because the lesions are so thick. The scales are very, very thick. So that is why it is called as a cradle cap. Okay, so this is pretty much all you need to know about seborrheic dermatitis. Seborrheic dermatitis is because of Malassezia yeast. Your body is going crazy. That is why it is an endogenous eczema. Alright. The next problem is stasis eczema. Again, stasis eczema is a very, very endogenous problem. Bahar se nothing touched you. But it is called as varicose eczema. What does that mean? So usually these people are, say, watchmen, okay? Sometimes anyone basically who stands for a very, very long time. It can be a teacher standing for a very long time. It can be a surgeon. But surgeons jaldi dekh lete hai ki okay yaar start ho gaya. They will not come to this stage, okay? But the predisposing reason for developing stasis eczema is standing for a very long amount of time, okay? So what happens when you stand for a very, very long amount of time? You have stasis in the lower limb, okay? The blood gets pooled over there, okay? And there's a lot of venous insufficiency. The blood is not being able to pump. There's pooling of blood. There is chronic venous insufficiency, because of which also your veins become dilated because itna blood niche it's getting accumulated that the veins, they just give away and they dilate, okay? That dilated veins, those are called as varicose veins. So it is associated with varicose veins, okay? Stasis eczema is an endogenous eczema. Say, suppose, keep this person as a watchman who's standing for a very long amount of time. After standing, uska bahut zyada blood was pooling in the limbs, because of which the veins give away and they developed varicose veins, okay? So here, because of the varicose veins, there's a lot of pooling of blood, and because of venous insufficiency, they develop ulcers, and these ulcers are usually non-healing. And if you look at this, you have to examine the patient for varicose veins. In the popliteal fossa, you will find varicose veins also. Okay, so that is why it is called as varicose eczema. वो varicose veins की वजह से, venous insufficiency की reason से they developed these non-healing ulcers. Okay, this is stasis eczema. The next thing is steatotic eczema. All of these are endogenous eczemas. Okay, this is called as eczema craculae. Craculae matlab there are a lot of cracks here in the skin. If you look at this, you see all these dry skin lesions which are having a lot of cracks. Okay, like this over here. Okay, so this is why it is called as eczema craculae, because the skin has cracks in it. You must have seen older, maybe your grandparents or someone having this type of skin. It is very common in old people. Okay, so steatotic eczema, that is eczema craculae, is common in old people. Why? Because as they grow old, the body is not able to produce that many lipids. Okay, so they have itchiness, they have dryness due to deficiency of lipids, that is lamellar body, and they have cracks in the skin. All right, this is all you need to know about the eczema craculae. Just remember the image, remember old people. Okay, the next thing is P. alba. P. alba is also a endogenous eczema. यहाँ पे क्या होता है? Pityriasis alba. See, I have a funny story with this. So I had P. alba when I was younger, and I was taken to a dermat, and they told me I might have vitiligo. And my mother cried the whole night because she was like, oh my god, my daughter has vitiligo. So the problem here is that there is a white hypopigmented macule in a child. Along with that, there is fine scaling. Okay? So what happened? There was a child, maybe 5, 6, 7 years old. On the face, usually it happens on the face, they have a white lesion, basically a macule, okay, on the face. But it is associated with fine scaling. So even if you do it with the finger, if you do this, there's going to be very, very fine scaling. Sometimes people think that it is a nutritional deficiency. It is not even a nutritional deficiency. Sometimes people confuse it with vitiligo. It is not vitiligo. Okay. Sometimes it may look like indeterminate Hansen's also, which don't worry about it. It is going to come very soon. And there also I'll tell you a close DD is P. alba. So basically it can look like 3 things. First, it can look like P. alba, which it is, pityriasis alba. It could look like a nutritional deficiency. It is not. It could look like vitiligo. It is not. It could look like Hansen's, which is leprosy, but it is not. Okay. Because why? Because Hansen's is in a child, but it is not scaly. Because of the fine scaling, you have to come to the right diagnosis. Okay? And what is the treatment? It is just your skin endogenously going crazy. You moisturize it, it gets better by itself. You don't have to do anything. Okay? This can also be asked as a question. Pityriasis alba. Kuch bhi nahi hua hai. It is completely asymptomatic. It is a white, depigmented, hypopigmented macule on the face in a child. What you do? You moisturize it. Okay? Yahi denge, this image they'll give you, and the options will be vitiligo. The option will be indeterminate Hansen's. But the minute they say that there is fine scaling, your answer has to be P. alba. Okay? The next, and I believe the last endogenous eczema is nummular eczema. What does nummular mean? Nummular means coin-shaped. Okay, discoid or coin-shaped. So you look at this looks like a coin only, na? Or a disc. So this is a discoid eczema. It is coin-shaped lesions with well-demarcated edges. You see, if you just look at it clearly, it's not irregularly defined. It is very well defined. The edges are very, very well defined. Okay. And iska diagnosis, a very close differential diagnosis is tinea. Tinea is a fungal infection. I've taught you in detail. How will you know that this is nummular eczema and not tinea? Because tinea, there's a little bit of central clearing. Here, that does not happen. Okay. So, nummular eczema. Okay, there's one more endogenous eczema, which is pompholyx. What happens in pompholyx? Again, you might have it. It's also very, very common disorder. But when we are younger, we don't understand what is happening. So, usually during winters, I have seen people whose finger, the edges, basically the sides, they become very, very itchy. Okay, so they keep itching. And when you touch it, you kind of feel that bumpiness. Okay, so that is what is pompholyx. It is an extremely itchy disorder. It is called as dyshydrotic eczema. On the side of the fingers, there are certain grains, sago grains like appearance. What is sago grain? That's sabudana grain. Okay, so on the side of the finger, you have sago grain appearance, which is intensely pruritic, and those grains are actually very, very deep seated vesicles. Look at the image. It may happen sometime in the year, maybe only in winters it can happen. Okay, you see this small grain like area over here, extremely itchy. The patient just doesn't stop itching. Ultimately, because of itching, they develop swelling and everything. Okay, but these are deep seated. Please ignore my spellings. Seated vesicles. Okay, this is pompholyx. This is dyshydrotic eczema, also an endogenous eczema. All right, so with that, we finish eczemas altogether. This is all you need to know. Some exogenous eczema, some endogenous eczema. Don't do PhD in this. Just read what is written over here, and that will be it. That's all you need to know about eczemas. Thank you.